Hi, and welcome to another episode of Smecco Connects. I'm Sonia Cox here with my co-host Tom Dennison, and today we have with us our guest is Karl Webner. So, Karl, would you introduce yourself and tell us and our viewers what your role is in your job and how you assist in the community?
Sure. Thanks for having me.
Thank you.
My name's Karl Webner. I'm a licensed clinical social worker by trade, and I have the privilege of being the clinical program manager within our St. Mary's County Health Department. I lead a team of behavioral health professionals in our health hub, which is located in Lexington Park, down on Great Mills Road. And we do basically anything behavioral health related, from substance use disorder treatment to counseling, medication management. We're kind of a one-stop shop where we offer services on a short-term basis to members of the community who probably need just a little assistance, getting through whatever might be challenging them at any given time.
Mm-hmm. And you say on a short-term basis. So what happens if somebody needs long-term care?
Sure. Well, a big part of what we do is helping people navigate the system, which can get a little challenging or a little confusing. So one of the things we make sure we do is kind of steer people toward the next step for whatever their particular healthcare journey might be. So, if someone's coming to us for some counseling or some medication management, part of our process with them is making sure that we refer them to an appropriate community provider who can kind of take over from there and continue the work that we've been doing.
Okay. So you help them find that provider?
Absolutely.
Okay.
Yeah, we're real big on warm handoff. We don't just give people a list and say, okay, well, let us know if you have any trouble. We will. We certainly can do that if that's what the person wants, but we are happy to make the phone call and, get that appointment scheduled. And we also like to follow up and kind of make sure they didn't have any issues getting to that appointment and that they feel comfortable. So we try to really carry it all the way through.
Well, this is an amazing service. I didn't even know that it existed. Do you know if we have this in all the counties down here in Southern Maryland, or?
I think I'm not an expert, so let me caveat. I've actually only been in St. Mary's County since the end of June last year.
Okay.
So I relocated specifically for this position and for this opportunity. It's been awesome, by the way. Big fan of St. Mary's so far. I do say I think some of the other Southern Maryland counties do have some behavioral health that they offer within their health departments. But I am not the expert on what they might have specifically. I do think our program at the Health Hub is pretty unique, especially to have the level of professional clinician that you're able to access through us, and to be able to do so on a walk-in basis, and also to be able to access it regardless of your ability to pay. That was another piece that I didn't mention, is you don't have to have insurance and you don't have to have funding to come start your process with us.
That's so great.
Yeah.
It used to be such a taboo subject. And I think I'm really happy that it has come to light as it has, and people are actually seeking the help that they need. And it's great to have an organization like yours where they can go. It's such an important part of your health, not just physical health, but mental health is important.
Yeah, absolutely.
It's important to your physical health as well.
Absolutely. I think it's, like you said, it's one of those things where people are affected by it in different ways. And one of the challenges when it comes to mental health is a lot of the stigma that is associated with it, and people not necessarily feeling comfortable with asking for help, or they're not even sure what type of help is available or what they might even need. So we try to be an accessible kind of one-stop shop where if you're not even sure what you need, come in, have the conversation with us, and we'll meet you where you are and get you where you need to be. So,
yeah, Karl, that's a great segue. Tell everyone a little bit about your background, how long you've been doing this type of work, and I know you said you've been in St. Mary's for about a year. What were you doing prior to that?
Sure. So, sorry, what I was doing prior to this was a little different, but I'll get to it. So my background, I'm a licensed clinical social worker. I've been involved in what I call the helping fields for almost 20 years now, which is crazy when you think about it. I started out in 2006. I've had quite a few different positions, but licensed social worker has kind of been the main kind of hub of what I do. Prior to my coming down here, I was actually involved in forensic social work. So that's the criminal justice system. And specifically, I was working with individuals who were found not criminally responsible by the court system. And one of my roles was to kind of monitor these individuals in the community and help them with their reintegration back outside of a hospital setting. So a little bit different working with that population. But interestingly enough, mental health affects everybody. And so whether someone's court involved or voluntary, or, whether they've experienced those types of consequences, of, challenges across the board, I think a lot of people's experiences are actually pretty similar. So community work has been a major passion of mine. I really enjoy local health department in general. I spent quite a bit of time up in Cecil County, living and working. You couldn't actually get farther away in a northern direction, literally, because you'll hit Delaware. So it's kind of interesting that I've been all the way up there and now I'm all the way down here. But it's similar work, similar, people are people. So no matter what, you see a lot of the same things and you see a lot of the same kind of challenges. And so just kind of putting resources in place and making people aware of those resources, I think has been a universal truth kind of through all of it. So
did you grow up here in Maryland?
I did. I grew up in Harford County.
Okay. Harford. And went to school for social work. And was that kind of just for those of us who don't know about the field, kind of what was your major in college? And kind of how did you get into it?
My first major, this is going way back, was theater, because I had no idea what I wanted to do.
Okay.
I went to Towson University. Okay. It turns out Towson had a pretty robust and challenging theater program. And I quickly realized that I wasn't going to put all of this energy into a major that I'd kind of decided on a whim. Maybe I thought it was going to be easy, theater, but no, it was incredibly challenging. So that didn't last long. I switched to psychology because I always kind of enjoyed it, but I still wasn't sure what I really wanted to do. Fast forward a little ways, I landed with Cecil as an addiction counselor, essentially. And that was work that I had done prior. And right around that time, this would have been maybe 2010, I recognized the need to continue my education. And fortunately, Salisbury University had a satellite program, and it was next door to the health department in Cecil County. So I had no excuses left. I had to go back. And it was a really smart decision. I'm thankful that I made it.
Good.
No, I just think it's fascinating. Yeah. I mean, I graduated with a journalism degree, and I'm working at Smecco. I always wanted to be a newspaper man, and I did that for a while. And I was very fortunate to be able to come here to work. And it just kind of, it's very common, I think, for people to go to college and then sort of find their own way.
Sure.
And I know from my perspective, it's great to see that you found your way into helping the community. So if just one last question for me real quick, Sonia, is that if you were to identify the biggest mental health challenge that you face in St. Mary's County or Southern Maryland, is it a substance? Is it a prescription related? What's kind of the main challenge that you have?
That's a good question. I don't think, I'm not trying to cop out on an answer here, sure. But I don't think it's any one thing.
Okay.
So one of the issues with mental health and behavioral health in general is it's kind of a pretty wide umbrella, and you get all types of presentations under that umbrella. And I think, depending on where I've worked and what I've seen, it's been different everywhere. I think part of the nature of the work that we do at the Health Hub is we get quite a wide variety of presentations. If I had to pick some trends, anxiety has been a pretty big one. I was working in private practice, kind of moonlighting as an evening job in Harford County. prior to last year, and we saw a lot of anxiety as a pretty common diagnosis. I think the other thing with trends is they change as we get better at identifying certain factors. One of the things that we hear about a lot is with regard to learning disability and the way that people kind of interpret and absorb, input and stimuli. And I remember 10 years ago, bipolar disorder was a very popular diagnosis for individuals. And I don't think it's necessarily that all of a sudden generationally we're seeing a huge increase necessarily in bipolar disorder, but we were becoming more and more aware of what this disorder was and what it looked like and how best to diagnose it. So all that to say, I think we get such a wide variety. It's certainly your substance use disorders. We have a lot of individuals who come to us for medication assisted treatment, which is another one of the options that we offer. Opioid use disorder, your heroin and your fentanyl and those types of things. But then again, you can't really separate out your addictions with the mental health side too, because they go hand in hand, and that's, people are complex. So all that to say, sorry, that was a real roundabout answer for you, but
I think it makes a lot of sense.
Oh, yeah, it's a great answer. Yeah. So if you might ask why SMECO, as the electric utility, is doing a podcast on mental health.
Crossed my mind.
Well, part of being a cooperative is concern for community. That's one of the cooperative principles. So in that vein, we are concerned about what's going on in the community and with our members and how we can help them find resources they may need. So that's one reason we're kind of stepping outside and not just doing podcasts about the utility, because, that kind of gets old after a while when you go through all these different subjects. But like last week, we interviewed the superintendent of Charles County Public Schools from a community perspective. So that was one reason that we wanted to bring you in, because like I told you, I didn't realize this existed as a resource. And if we can get the word out there, that to tell people who may need some mental health care that this is available for them, that's what we want to do. So I really appreciate you coming in. Let's talk about so you said short term, and I asked you about, the handoff. You talked about the handoff to a provider. Is there a shortage in St. Mary's County for mental health providers?
Statistically, yes. And I will look over here at my note because there was one. So St. Mary's County as a whole has been designated a health professional shortage area by the U.S. Health Resources and Services Administration, which isn't uncommon when you look at more rural kind of communities. It can be a challenge to attract the kind of licensure and degreeing and the level of professional needed. And that's across the board. That's not just St. Mary's. When I worked in Cecil, that was definitely one of our biggest challenges, is how do we get the talent in the room to help the people? I would say there can be challenges. There are wait lists. I will say, we have a ton of talented community providers in St. Mary's. But location matters a lot for a lot of our clients. One of the reasons we're down in Lexington Park on Great Mills is that's where it was needed. But the truth is, you could use a health hub, all the way down in the lowest part of St. Mary's. You could use one, up this way. There's, for some people, a couple of miles might as well be a couple of 100 miles, because depending on your access to transportation and, your ability to get there matters a lot. What I would suggest for people that are really experiencing that challenge is, come bring it to us. And even if you don't necessarily want to use us for our direct care services, we're happy to help navigate that. We have a ton of really talented care coordinators and individuals whose sole purpose is to kind of help navigate those systems. And if you get put on a wait list, if there is kind of a delay in starting your recovery process, then come to us and we can help kind of, bridge that gap, which is definitely, what we're there to do.
That's great.
Yeah. So I assume the vast majority of your patients are adults. Do you also see children?
We do.
Okay.
We do.
And is there any certain criteria or whatever that you've seen with the younger people who are coming to see you?
Well, so in addition to the health hub, we have 2 school-based health centers.
Okay.
And I hope I don't mess this up. They are at Margaret Brent,
Mhm.
which is not too far.
Yeah,
We
just down
passed
the
it on the
road.
way here.
Yep.
And Spring Ridge, which is down in Lexington Park. And we specifically have 2 wonderfully talented professional counselors who specialize in working with children. And they are now actively taking referrals for school-based age kids and seeing them throughout the day. And it's nice because they have a captive audience too, especially if it's the school that they're placed in that has the issue. They can get them out of class and start that. I don't think I would know personally any trends that are happening with children that young. It's not something we get a ton of at the health hub, but if you want to bring in your minor child, we totally can work with them and see them. My team could probably tell you more better than I can
Sure.
about a lot of the things.
And
that they're
potentially
seeing.
point the parent or guardian of that child in the right direction. On
Yeah, absolutely.
whether you can provide the service or someone else in the community may be better suited, they could probably point that person in the right direction.
Yeah, absolutely. It would be very similar to working with an adult. We could, see them short term and figure out what makes the most sense and then facilitate that referral, whether it be for, a counselor or medication in some cases. It kind of just depends on which. We like to handle everything individually. You don't want treatment to be cookie cutter or one size fits all. You want it to be really individualized and meant for the person and accessible. Those are kind of the biggest things.
Yeah,
Absolutely.
that's great. Just talk about, did you see any changes when COVID happened? Like increase in anxiety and that sort of thing. I mean,
sure. It's funny because it started a 4-year, for me personally, straight working from home situation.
Mhm.
It changed a lot of things for me
right.
professionally. I'll tell you, it was really hard on providers. It obviously, COVID being an incredibly stressful time, a lot of uncertainty, a lot of changes in the way that people were connecting, a lot of isolation. That absolutely had an impact on individuals who may have been relying on those connections and kind of those services. It created a really huge kind of jump in telehealth,
Mhm.
which I don't think is a bad thing
Right.
necessarily.
Sure.
Because again, you want to, the biggest thing is treatment needs to be accessible. So if telehealth works the best for, someone living in, say, a rural area, then that's a good thing. But at the same time, it also caused, I believe, a fair amount of the shortage, the wait list. Gosh, now we have all of these people who are experiencing all of these challenges, with uncertainty in the world. Is a stressful time.
It was.
Yes.
So yeah, generally, I do think that kind of changed the landscape a little bit. I think it's something we're still kind of recovering from and learning from. It changed if you want to get super technical, it changed the way billing was handled.
Mhm.
There were a lot of kind of leeways made to make things a little more easier on practitioners, and some of those have been dialed back now. So it's kind of an ever-changing thing. But yes, COVID, I would say, certainly had a major impact on behavioral health. I can't imagine there was a person that it didn't affect, in a
Yes,
major way.
I agree.
Yeah.
I mean, personally, I took over as CEO on March 1st of 2020.
Gosh.
So it really affected
Yeah.
affected me. I had all these plans of things that I wanted to do in my first, 6 months in the job. And I just remember standing up at the window and the picture still gets posted and me taking a picture of the parking lot and there was 3 cars out there.
Mm.
And I'm in here and I have the TV on constantly trying to get updates on what's going on. Right. After about 2 weeks, I was like, I got to turn this thing off. I can't do this anymore. So,
Yeah.
I mean, I'm sure it affected a lot of people in those same kinds of ways.
It's an incredibly difficult time. And knowing that the health hub is there, is that a part of the Department of Social Services or the health department, or what kind of agency do you fall under?
So we fall under the health department.
Okay.
And actually, this is a great time for me to say we're not the only program in the health hub.
Sure.
So in this building that it was a bank, I believe. So in a pretty small footprint, we actually have quite a few services available. So my team, typically we're called the crisis walk-in, because you don't need an appointment. You can just come in and be seen Monday through Friday around 8 to 5. And that's my team. And so under me, with my team, we have a psychiatric nurse practitioner who handles our prescribing practices and is also doing some therapeutic activities as well. We have, including myself, 3 licensed social workers who are basically our counselors, our therapists, and they also do some care coordination. And then we also have our peer recovery specialist, who is a person who themselves are working a personal program of recovery. They identify as someone who's in recovery from a behavioral health condition. So they're a great resource for, showing kind of the resilience and the coping strategies and the things that new clients might really need to see. She's also wonderful when it comes to the care coordination piece and the case management. It's funny. People who aren't struggling with a challenge, with their mental health, sometimes have difficulty navigating some of these paths and some of these, resources. So for someone that's actively dealing with one of those challenges, it's even more difficult. So that's why we have so many supports as far as helping them get. So that's my team. We also have a very well fleshed out harm reduction program. And harm reduction is essentially meeting individuals where they are and working with them to reduce some of the damage that can be done by active substance use or challenges involving mental health. So it's a public health initiative in which people are engaged at whatever process they are when it comes to their behavioral health, whether they're wanting to make some changes or even if they're not wanting to make some changes. There are benefits to engaging with the health department and getting some of those resources. We also, there's just so many other smaller programs too. We offer Reiki therapy, which is, I'm not an expert in it, but it's essentially energy massage. It involves not physical touch, and that's free too. Day reporting, we have partners with the detention center and the sheriff's office so that individuals who are supposed to be going and checking in with the sheriff's office can actually come, down to our place and meet with their agent. That kind of ties in with the transportation piece. And if it's difficult for you to get to Leonardtown, it might be easier for you to come to us. We also do a ton of navigation when it comes to benefits. If you believe you might be eligible for Medicaid, for example, but you went on the website and it was confusing, because it is, you can come to us and we'll walk you through it. Sometimes we can even just do it over the phone with you. So there's a ton of different resources at the Health Hub. And if you go to the website, you can see all of them. You can sign up for an appointment for them if you're interested in that, or a lot of it is walk-in basis too.
Okay. Well, we here at SMECA, we have an employee assistance program too for our employees. So if they need help, well, they can always call there as well. But it sounds a little bit like, well, that would certainly be short term. And I don't think we have the same kind of handoff that you guys do. So I think that's great. That's a great program. Also, we have 2 of our employees that have been certified in mental health first aid.
Okay, wonderful.
So we've started having some of our employees come in, just trying to help them understand when they're dealing with other employees or friends or family, the signs to look for. We're not the mental health first aid providers aren't diagnosing anything. They're just trying to give you tools to help you recognize when someone might be in crisis.
Yeah.
So we just started that program recently.
That's wonderful. we didn't plan this, but I actually am signed up tomorrow to start mental health first aid instructor training.
Okay.
So I have 3 days of that this week. And I'm looking forward to it. One of the things I like so much about mental health first aid is you don't have to be a clinician to benefit from it. It's actually easier in some ways if you have more of a layperson background. And I like that it encourages the conversation, right? Just like you guys, wanting to have me on and talk about this. I think one of the most important things about mental health is that people be comfortable discussing it, because it's very easy to feel isolated, or that, my problem couldn't possibly be similar to someone else's, and that, there must be something wrong with me. All of these negative connotations and the stigma that comes with seeking help. So the nice thing about mental health first aid is it encourages people to be more comfortable with not being okay. And to have that conversation, because I think that's just as important as getting to the treatment and to the resource. Because if people aren't comfortable even discussing it, they're not going to get the help that they need. So I think that's a great thing to have your team involved in.
Good. Yeah, we thought so. It's just as important as CPR,
Yep. Which is also good.
Right. Exactly. Yes. How about inpatient treatment? Is there an inpatient program in the area? Do you know?
This is where my resources don't probably match up. So, or at least my knowledge of them, I'm sure. No. So inpatient typically is still divided between substance use disorder treatment and like psychiatric. There are some resources at the county hospital to start that process for psychiatric, but it is short term, to my knowledge. There is also a partial hospitalization program out of Calvert Health that I'm familiar with, because we've had some people go there. For substance use disorder treatment, we do have, at least in the Tri-County area, a handful of dedicated partners. Project Chesapeake would be one of them. Pyramid Healthcare, formerly known as Walden, would be one of them. I do think it's another one of those resources where we could benefit from more, because it tends to be pretty labor intensive and resource intensive. So, and the stays tend to be a little longer. So it could be one of those situations where it would be nice to have more beds, more availability. But that's probably true for every behavioral health resource across the board.
I tell you, Sonia, I mean, with these podcasts, it's amazing how much, at least I learned, whether it's talking to longtime SMECO employees or members of the community, and just learning about the services that are available and the professionals who are out there, like Karl, is really a really good thing. And I think this is great from a education perspective. So, I mean, with that, I just want to commend you for your service and for your work on behalf of the community. I mean, it's a really great service that I know all of us, at least me personally, have been touched with mental health, whether it's ourselves or our family members or close friends. So knowing that those resources are available is a really great thing.
Yeah. Is there anything that you want to add that we didn't touch on? Any other statistics that you think may be important? Or
I've never been a super research-oriented practitioner, so statistics never came that easily to me. But one of the things I would say, because one of my hopes is that the person that needs to hear this hears it. And I would encourage anyone that isn't sure, maybe they're not even sure what they need or how things could get better, to reach out. I think one of the things that I think about a lot as a program manager and someone who's fortunate enough to have such a talented team full of people who are so good at what they do and who are really dedicated to this work, which, again, and thank you for the accolade, but it is challenging work, but it's also super rewarding. So it's kind of a balance there. But with all of that, I would encourage anyone who isn't sure how we could help them to reach out and ask, because it doesn't have to be as formal as an evaluation or a diagnosis. I think I think people get hung up on the idea of labels, especially with a healthcare system that's run a bit like a business at times too. And if they're hesitant because of those challenges or those concerns, or they think, maybe that's not for me, I think we would love to have a conversation with them. And I think we would love to have them stop by. And maybe it's not something as heavy as, getting into, a weekly therapy session with a clinical social worker. Maybe it's as easy as meeting a peer and having a conversation, and it changes something for you that you didn't know needed to be changed. So I would just want to encourage anyone who is even just thinking about it to give it a shot, because if they don't, we'll just be there waiting for them to eventually come in, and we're there either way. Right. So I would just want to add that.
Excellent.
Yeah, I want to echo what Tom said about your service and what you're doing for the community. It's much needed and much appreciated. And I'm sure, hopefully, the success stories keep you going.
Absolutely. And there's been a lot.
Good.
We get feedback all the time. Gosh, we didn't know you guys were here, and this is amazing, and it was so much help. And now that we know you're here, we're going to tell everybody. Word of mouth is probably our strongest advertiser still.
Absolutely.
And there's nothing I like more than meeting someone new and watching them kind of stabilize and grow, and then handing them off to a practitioner, knowing that they're going to be continuing that journey for who knows how long, right? It's genuinely interesting work for sure. And yeah, I think, the feedback we've gotten from the community has been overwhelmingly positive, which is great.
Well, thank you so much for taking your time out of your day to come and visit with us. And hopefully this will get out to the community and provide them with some additional resources that maybe they didn't know existed. So I want to thank you for your time.
Absolutely.
Thanks,
you both.
Karl.
It's very nice meeting you.